Despite queuing in the bitter cold, there was an air of optimism among the over 80s and their families in this line, waiting patiently for their COVID vaccine.
We're looking forward to it.
I'm feeling absolutely over the moon. I can't wait, because it's the biggest worry for us is obviously for them. Anything that we get, perhaps we could deal with,
Once inside, there's more socially distanced waiting. Your temperature is taken before you go through to get the jab. This is one of 7 large vaccination centres that have opened today. In this very room, you've got 30 people who are actually vaccinating. The rest are giving help and advice. Only over 80s have been invited to come in to get their vaccination today. Staff have told me they expect to get through hundreds of people, and they're working as fast and as safe as they can.
It feels absolutely amazing to get here today. Obviously, there's been vaccinations already been undertaken through GP surgeries and through the acute hubs, and this is now the next stage of the vaccination rollout.
But there are worries from some GPs that the new centres may be confusing for many over 80s. The British Medical Association told us that vulnerable older patients shouldn't be travelling long distances to these places when they can go to local health centres to get a jab. What are some of the concerns that BMA has about the vaccine rollout and these new vaccination centres?
Mass vaccination centres will play a crucial part, particularly for mobile patients, for healthcare professionals, but for our more vulnerable patients in their 80s and 90s. They need to and want to be vaccinated in a local practice close to where they live. And we can do that if we get the vaccine.
The vaccination numbers released today show more than 2.2 million people have received their first dose of a COVID vaccine. In Scotland, it was announced everyone over 80 will have their first jab by February. And in Wales, the health minister confirming all over 50s will be offered a vaccine by spring. The Prime Minister, who toured this new centre in Bristol, trying to strike a balance of hope, while at the same time warning that complacency isn't an option.
Now is the moment for maximum vigilance, maximum observance of the rules, and of course, if we feel that things are not, are not being properly observed, then we may have to do more.
Stark messages continued throughout the day. First from the UK's Chief Medical Advisor, Chris Whitty, that the next few weeks will be the worst for the pandemic. And then this from the Chief Exec of NHS England.
Stay at home and not put ourselves and other people at risk through transmission. We now know how this virus spreads, and in many parts of the country, it is spreading out of control.
This piling more pressure onto the government.
Get back to the spirit of March, because this really is going to be, this week, the next few weeks, like to be the darkest weeks that we've faced during this pandemic.
Back at the vaccination centre, the only place that seems to have a slightly jolly atmosphere, 93-year-old Heather is delighted to get her vaccine. A nurse in the NHS for 30 years, she has this message for those who might be worried about getting one.
Do what you're told to do. Don't be afraid. I mean, taking it is nothing. It's a pinprick. It doesn't hurt. It's over in just a moment. And if it's going to help the whole system, it's good to do.
Well, we did ask to speak to someone from the government, but we were told that no one was available. In a moment, we'll speak to the Shadow Health Secretary, John Ashworth, but first, Elliot Colburn, who's the MP for Carshalton, near where Victoria MacDonald brought her piece from tonight. Elliot Colburn, just to recap on some of what Victoria found, Epsom and St Helier Hospital ran short of oxygen. 3 people died with COVID in ICU there just today. And a nurse there told us that it was like a war zone. What more do you want the government to do to help your NHS in your area?
No, the picture was very bleak, Cathy, indeed, and it reflects what the Chief Exec of St Helier Hospital has been telling me for the last couple of weeks. Really, what the NHS leaders locally have been telling me that they need to see is people following the lockdown rules, is obeying the rule to stay at home, and indeed that message that we heard today of behaving as if you yourself have coronavirus, because that is the only way that we're going to bring transmissions down.
Okay, do you think that the government also bears some responsibility for what's going on now? Because they could have locked down before Christmas. Do you wish they had?
Well, I think the government has responded appropriately in terms of the timings and the advice that it's been given. I think St Helier in particular has an additional problem, which is that it's working on essentially 80-year-old infrastructure. The hospital is incredibly old indeed, which is why we do need this new hospital in Sutton, which is indeed going ahead. But the infrastructure there, as we saw with the oxygen supply, certainly didn't help.
Would you say, looking at what you've seen and what you know from your patch, that the NHS locally is being overwhelmed now?
It's certainly on the brink, I would say, Kathy. We've only been able to get to this stage, I would say, because of the excellent inter-hospital working that we have in South West London. The chief execs, I know, work very closely together and have been able to support each other's hospitals. But really, unless we do bring those transmission rates down by staying at home, following the rules and behaving as if we have the virus, we're going to continue to see scenes like those scenes we saw at St Helier.
And does that include the Prime Minister not going on 7-mile cycle rides from Downing Street?
I'm afraid I haven't seen that report, Kathy, so I couldn't say anything. But what I would say to people is that they do really need to obey those rules about staying at home and being as close to home as they possibly can.
When the Prime Minister spotted 7 miles from Downing Street on a cycle ride, does it send the right message? Do you wish he hadn't?
I haven't seen those reports, I'm afraid, Kathy, so I couldn't say. But all I would say, again, is that people really should be following those government guidelines and staying at home.
Elliot Colburn, thanks very much for joining us. Well, joining me now is John Ashworth, the Shadow Health Secretary, who's in Leicester. John Ashworth, when you look at 2.6 million doses of vaccine already administered, do you accept that is an impressive achievement?
Yes, and I'm really, really pleased. I'm so pleased that we are rolling out this vaccination programme. We've got to go further and faster, though. I think the government will hit their target for 14 million vaccinations by mid-February. But if we were able to do just shy of 30 million, we'd prevent 99% of hospitalisations and deaths. So that is a big target we should be striving for.
But how do you do that, given that there are limits on supply from what we can gather at the moment?
Well, we need to understand what exactly it is that is limiting supply. And I take your point. If there are finite doses, well, there will always be finite doses, but if there are limited doses here and now, I think I'd hope the government could give us a target for when they could hit 30 million vaccinations, because that really would reduce hospitalisations. But in the next 2 weeks, I would also hope that the government could really put rocket boosters over their vaccination plans for frontline NHS staff. We've got over 40,000 staff who are off sick with the virus. I talk to many staff. They tell me that they felt unprotected in the first wave without adequate PPE, and they feel unprotected now because vaccination for staff is not being rolled out as quickly as it should. So if we can vaccinate staff, it will help us with these intense, awful pressures that we're seeing on the front line in our National Health Service.
Should staff actually be prioritised over some elderly then, do you think? And also, do you boost teachers up that priority list so you can open schools again?
Well, NHS staff are obviously in one of the top 4 priority groups, and I think that's quite right. What I'm saying to the government is let's really push out the vaccination across the hospitals so that those NHS staff who are under this extraordinary pressure at the hospitals like at St Helier and in my own here in Leicester are given that protection. I wouldn't change the top 4 priority list. I know there is a very good case for teachers and other frontline public sector workers. I understand why they are asking for it. But if we can push ahead with vaccinating those top 4 groups, we will reduce deaths hugely. Over 80%, 88% it could be. So I think the top 4 priorities is the right approach for now.
When you hear the Prime Minister admitting that oxygen supplies are running short in some places, and we've seen that ourselves in our report tonight, do you think that the NHS is already being overwhelmed in some areas?
Oh, I am so worried. I'm so worried. I can't tell you about the situation our NHS is in. We've got more people in hospital than last time. Our staff are exhausted. The NHS is on its knees. And these concerns about oxygen supplies are alarming. I hope ministers are putting in place a plan now to secure oxygen capacity throughout this crisis.
And should that involve the military, if need be, who are helping on the vaccine deployment?
Well, I'm not sure if the military can guarantee oxygen supplies. Of course, we should use them. But St Helier isn't the only hospital where have had issues with oxygen supplies. We've heard this now from a number of hospitals raising the alarm over it. So I hope ministers can just come forward with a plan to reassure us that no hospital will run out of oxygen throughout this crisis.
John Ashworth, thanks very much for joining us.